make sure you're recording, please. We'll go live in 20 seconds, and then this will live on YouTube afterwards. Good evening, everyone. We are excited to get started. This is the Autism Hero Project's medical insurance grant virtual Q&A. We're going to talk about all things the Autism Hero Project, all things autism, ABA, and more importantly, medical insurance coverages for the 2023, actually really 2024 calendar year. All of our applications are currently live on our website. So if you don't know about the Autism Hero Project, let me just fill you in really quickly. We are a 501c3 nonprofit organization that exists to do three amazing things. One is raise a whole lot of autism awareness, but as we like to say, it's not enough to raise awareness if it does not convict you at the heart to be an agent of change and an agent of inclusion. So we need a whole lot of autism awareness and acceptance. The second thing that we do is we put on a lot of inclusive pop-up opportunities and events, anywhere from theaters to trunk or treats to Easter celebrations to holiday stuff and everything in between. But the third thing that makes us, I think, the most famous is that we give a lot of scholarship grant application access to two things. One is access to all things therapy that is inclusive of ABA therapy, applied behavior analysis therapy, because we know that it's very challenging to gain access to ABA therapy for all kinds of reasons, and we'll get into that in a minute. But also this year, we're super excited that we actually launched a second line of scholarships and grants for our evolving heroes. Those are for anyone who is seeking, whether that be university, college, a skill or trade, vocational school, where now anyone beyond the high school level who is looking to gain access to things like Microsoft certifications and bachelor's degrees and master's degrees and on the autism spectrum, then we give out $2,500 financial scholarships to help autistic adults, because we know that autistic children will also become autistic adults and they still need access. So I wanted to kind of share with you guys our website where you can find a lot more information about who we are. If you've never been to our website, you're going to go to autismheroproject.org. And when you get to the site, you're going to see a whole bunch of great things, anywhere from, some data and statistics, which we'll go over in detail. But currently the autism prevalence in the United States of America is 1 in 36 children. So that means that for every 36 children in the US, one will be diagnosed with autism spectrum disorder. As you can see, the prevalence has increased annually. And since 2000, autism prevalence has increased 317%. And you can just see back in 2000, it was 1 out of 150. Compared to today, it's 1 out of 36 children. I wanted to kind of go over a little bit of our vision and our mission. Our vision has always been to prepare kids with autism for the world and prepare the world for them. I kind of talked a lot about our mission already. It's kind of threefold. What a lot of people may not know is that we actually wrote a law that got passed a couple of years ago, making the first week of April Autism Awareness and Acceptance Week, where we commemorate this week-long festivities and celebrations to put on inclusive events, create education in school districts, companies and organization, all promoting inclusivity and belonging. And then if you want to know much more detail about what we do and how we do it and why we do it, right on our front page, you'll see several videos, as you can see here. And then we're always talking about including, whatever events we've got coming up. So I invite you to check out our website, autismheroproject.org. We have our grant applications right here, and then we have a list of resources as well as Florida resources. We exist to kind of create access all over the state of Illinois. We have no boundaries in the state of Illinois and no boundaries in the state of Florida. So we fully grant these medical insurance grant applications as well as our scholarship applications to anyone who is an Illinois or Florida resident. If you go to the grant application website, you're going to see a Q&A. This YouTube video will be uploaded to replace last year's after today. And then we have our application both in English and Spanish. You can just click download all of the instructions step by step to submit your application, as well as we have a whole live Q&A where we've answered all of your pertinent questions. And so you'll see there's a whole list, some examples right there. And I won't go into too much detail because this video will cover most of it, but I will want to make sure that everyone who's watching today, we want to give a shout out for joining us. And we'll be monitoring the Facebook Live. Our board members are there to answer your questions as we go along, as well as our insurance broker and Layla, our guest, who will be speaking about ABA shortly. But I think the most important thing that I want to really point out, just from years past, every application that we've got, and we always get questions about specifically what our medical insurance grants cover. And so I want to be very specific. Our medical insurance grants cover medical insurance premiums only. Our grants do not cover deductibles, co-payments, or co-insurances, or out-of-pocket expenses. So why is this important? Because I don't want you to waste your time to complete an application if you're just looking to get your co-pays, deductibles, and co-insurance covered. Also, there's an amazing program that's available in most states called HIP, and HIP stands for the Health Insurance Premium Payments. Usually it's the Department of Health Services for every state that offers a program for our Medicaid recipients. And the way that that works is every state has some quite different stipulations. So I'll speak first to Illinois. In the state of Illinois, and I've put some really clear examples. If you go to our resources tab specifically here, I go through a whole deep dive on what is HIP, hyperlinked it so that you can get all of your frequently asked questions as well. But it's really a great example of people who currently are Medicaid recipients, how they can still access, if their Medicaid doesn't give them access to ABA therapy, how they can actually access it once they start getting ABA through a private insurance broker and pay 6 months worth of premiums. It talks about how you can actually get approved for the state to come in and take over your monthly premiums to acquire that private insurance. And as long as you continue to be applicable for Medicaid, then you will continue to be able to get this private insurance monthly premium covered. And there's much more detail. I'm kind of doing just a quick overview. And we're going to jump right back into this whole part with the Q&A and the questions right after we talk a little bit about specifics about ABA therapy. If you're here, then you probably know a lot about autism already, or you may be recently diagnosed. We've been getting a lot of emails and phone calls over the last 3 weeks for people who have heard about our medical insurance grants, who are new to the autism diagnosis, and they're just at the beginning. They're just getting their journey started. And so you've come to the right place. Our guest is from ABC Health, and she's been with us year after year for a few years now. She's one of my authors in my book, For the Love of Autism. We love Layla. So without further ado, let's jump right in and introduce Layla. Will you come on? And Layla, do you want to share your screen
Sure.
as we talk about all things ABA therapy?
Can you see my screen
We
now?
can,
Well,
absolutely.
thank you for that introduction, Tamika. I truly appreciate the Autism Hero Project and all that you all do for our kids. As Tamika mentioned, my name is Layla Ayad Al Harsha. I have just about a little over actually 25 years of experience in the field of education. In my past, I was a former educator for about 15 years, and the last 10 years, I had been an assistant principal in a public school and then a director of education for a therapeutic day school for children with autism. But most importantly, the work of my life is as a parent of a child on the spectrum and now an adult on the spectrum, which is why I truly believe that ABA therapy, I'm a huge proponent of it because similar to everyone, listening in, we started off somewhere with our son. And where we started off with my son was gosh, about 14, 15 years ago as a parent, as a teacher, and trying to figure out the world for my son, and just wasn't really sure which direction to take with him. We had gotten his diagnosis, and then, of course, naturally, we thought, well, he wasn't speaking. So we thought, well, let's go ahead and start speech therapy. And we did that for a while, speech, and we did OT, and we did some physical therapy. But really didn't see, we saw some improvement, but it was very slow going. And then just, continued to do my research and found ABA therapy. And that for us changed our lives and changed his life. So much so that I decided to go back to school for it because I decided at that point our son is going to go back, or actually, he's going to live with a behavior analyst. And that's truly at the crux of why I had returned to school, is to help my son. And actually, I saw that it was benefiting the children in my classroom as well. Um, let's see, about 14, 15 years, or actually 10 years after that, and 14, 15 years after my son was diagnosed, I find myself helping other families and supporting families in many different ways, and very thankful. Right now, we do have a clinic and we are servicing children with autism, and majority of them are just recommendations or referrals from other families, and just doing my best to educate others on the importance of ABA therapy, because honestly, if we did not come into ABA therapy, my son would not be able to do so many different things that I'm going to be talking to you guys today about. So let's talk about ABA therapy. As Tamika mentioned, we know about what we know about autism is it's the fastest growing developmental disability in the United States. And 1 in 36 children have an autism spectrum disorder. I believe when my son was diagnosed way back in the day, it was 1 in every 200. And as you can see, and as Tamika showed you with the beautiful visual she had up, and unfortunately, the numbers have increased. And so we've gone from like the 1 in 200 to 1 in 150 and to 88 and 44. And now 1 in 36 children have an autism spectrum disorder. Boys are 5 times more likely than girls to have an autism spectrum disorder. And it, as we may know, as parents, we see an impairment in communication and social interaction. We see stereotyped patterns of behaviors, and they are repetitive. And most importantly, early intervention is critical for our children. Being a parent of a child with autism is like flying a rocket ship, as we all know, without a manual, right? And all the passengers are telling us what we're doing wrong. And basically, oops, sorry, go back to this. Oh boy. Not sure if you can still hear
Yes,
me.
go ahead, Layla. We're
Okay,
still here.
sorry, completely lost my screen. Let me go back, sorry. I'm going to go back to this. Apologies on that. And technology these days, actually, my phone is off. No. Okay. So basically being a parent of a child with autism is like flying a rocket ship. So basically we kind of think that we know what's going on with our kids. And we're trying to navigate that whole piece for ourselves. And then everybody is on the other end telling us, you should do this, you're doing this wrong, you're doing that wrong. And on our end, we're never given a manual, we're never really told what to do. And then basically just trying to navigate everything on our own. Well, with ABA therapy, you're no longer flying on your own. You've got therapists, you have behavior analysts. Everything's kind of data driven, so we take data on everything that we're doing, and we find what's working and we find what's not working, and we continuously work, and everything's really highly individualized to meet our children's needs. ABA stands for Applied Behavior Analysis. It's based on over 60 years of research, and it is evidence-based, and that's most important. It is the scientific approach to understanding behavior and why it occurs. What do we teach? We teach language and communication skills, social skills, self-care skills. We teach academic skills. We work on decreasing problem behaviors as well. Our focus in the beginning is behavior reduction. And so we work to reduce problem behaviors. We teach children to request their wants and needs. And oftentimes what we do find is that in order to communicate, our kids use their behaviors. And if they wanted something, they pushed and pulled at us. And there's this nonverbal form for us mothers. So we know when our children are infants, they cry to get their needs met. We know when they need a diaper change, we can read their nonverbal cues. And so what happens is when your child has language and loses language, you start to learn those cues. Or for some of us, right off the bat, there's no language, and we start to take those cues and make those cues their language. And so our job and our role as behavior analysts is to find out what they're communicating through their behaviors. So we teach them immediately to request for their wants and needs. Again, we work on behavior reduction and independent toileting, and we work to reduce any problem behaviors that interferes with learning. What do we know about behaviors and how we can reduce the behaviors? What we do know is that behaviors can be an attempt to communicate, and there are 4 reasons why children may engage in behavior. So we talk about the functions of behaviors. One being attention, another being escape or avoidance, another being for access, and lastly, automatic or sensory maintained behaviors. So some children may engage in behaviors for attention, meaning they may be seeking your attention and may not know how to get your attention, but they've learned in the past, well, when I push or pull or I may break something or throw something, it catches the attention of my parent, and that communicates that I'm seeking that attention to them. Likewise, if they're doing it for avoidance, they may not be able to communicate to you that I don't want that, I don't like that, I need a break. And we see this often, we see a lot of these behaviors with our neurotypical children who may engage in, tantrum behaviors to get their wants and needs met. So you think of access, and you think of children who, want something, they tantrum and they get their needs met that way. And so for us, it's kind of like we're working as detectives and trying to figure out, well, what is that behavior trying to communicate? So we build on a lot of the proactive strategies for our kids. We work on teaching them choices and providing choices. We teach them to wait, and waiting is a life skill. We wait at the doctor's office. We wait in the line at the grocery stores. And oftentimes our kids don't have those skills. And so when you have those major meltdowns, when you're trying to be out in the community, it makes a difference when our children are taught to wait. And so we work on varying tasks for them. We teach them to accept no, because oftentimes when you say no, it is a challenge. So we work on that, and we're very specific on how we do so. We also look at the varying difficulties of tasks because maybe something's too much for them. So we may break things down into smaller, more manageable steps for our kids. We incorporate schedules just like for everybody. We survive on our calendars and our schedules. So schedules and visual schedules are very important for our kids. And building relationships with our children is very important because that is the basis and foundation for teaching skills as well. Reactive strategies are always dependent on your BCBA and they're highly individualized. So that I'm not going to go into today because I don't want to give anybody strategies that they try and it may not work for their child because it's highly individualized and based on, all of these different things that we do as BCBAs to prep for that as well and react to that. Additional skills that are targeted through ABA, we work on building tolerance for change because oftentimes our kids are not comfortable with change, right? We work on expanding food variety and accepting changes in schedule and adapting to unexpected situations. facilitating independence in the homeschool and the community. Oftentimes we have difficulty bringing our kids out in the community and working on those through the therapy and going out with even the therapist in the community and working on those is very important because we don't want to limit our children. Um, we work on personal hygiene, we work on toileting, completing chores within the home, leisure skills, which is very important because when our kids don't know what to do, they sometimes get themselves into trouble at home doing things they're not supposed to be doing. So those leisure skills are very important. And all of everything that we work on is with a grand goal of increasing independence for our children. So most importantly, change and progress. What's important to know is that change doesn't happen in a day and it does take time to make progress. And progress can happen each day, and daily progress leads to big results. And that is our ultimate goal as providers. We want to make sure that at the end of the day, as I mentioned to you before, I have a 19-year-old on the autism spectrum. It went like this. We were 3.5, 4-year olds, a 4-year-old not too long ago. And for me, I was always kind of wired to, well, when he's 22 and the bus stops, what are the skills that he needs to live an independent life as possible? What are the things that are the most important so that he doesn't have to rely on anyone? And those are the things that we target in ABA therapy. We do work to make sure that our children are going to be able to live an independent life as possible because when they do so, they live the best life for themselves.
Thank you, Layla. We appreciate you. If you want to stop sharing your screen real quick,
So thank
so
you.
they could see your beautiful face. um, so I know I didn't mention before, but the Autism Hero Project was founded. The whole genesis behind it for me was my son's personal autism spectrum disorder diagnosis. And that obviously changed the trajectory of our lives forever. And when I started, the Autism Hero Project, for me, the reason why I thought it was so crucial was because I was fortunate that I had amazing medical insurance, but every day I was finding out about families who could not access ABA therapy and other therapies because either they were uninsured or underinsured. And so that's what made the Autism Hero Project, come alive, is granting access to families who, the uninsured is very obvious, right? You don't have medical insurance, so you don't have access. But if you were working, say, a union job or an organization or company that was self-funded, and because they self-funded their own insurance, they decided that they weren't going to cover autism needs, then that also created a severe, a major problem. And to me, it just seems honestly almost criminal that you have children, who need access to all the therapies that they need to thrive and strive and unleash their full potential so that they can literally achieve, independent skills if that's something that was capable of attaining, or just really helping themselves to be independent, contributing members of society the way that they want to. And so that's why we created access to these grants so that they can access all of the therapies that they need. And the only one that we audit for was ABA therapy because ABA therapy at the time in the state of Illinois, Medicaid did not give access to ABA therapy. And I've written several books towards, but my latest one that came out last year in April was called For the Love of Autism. And I kind of mentioned earlier that Layla's in it, along with Dr. Temple Grandin, Dr. Carrie Magro. Quite a few autistics are in here, as well as parents, BCBAs, grandparents, and then the co-founder of Aspiritech. It's a great book. I highly recommend. You can find it on Amazon, especially if you're early on this journey, or even if you're not. Um, it's so insightful, and I highly recommend it. So I also wanted to quickly, but I actually will save that. Actually, no, I'll share it real quick. I wanted to kind of share just momentarily that we have two events coming up before we introduce our next guest. And so let me just share real quick. I know I've already talked about who we are and what we do, but I wanted to make sure that I show you these two great events that we are a part of. And one of them is sensory friendly theater experience of Disney Pixar's Finding Nemo Jr. Anyone who would like to register, it's going to be at the Hemmons Theater in Elgin, Illinois. Tickets are absolutely free for anyone who would like access. You can scan that code, QR code, or if you're watching from your cell phone, then go to our website or go to our Facebook page, and you will see that we have the event there as well. And you can click on the link to register yourself, your family, as well as that's on just FYI, that's on Thursday, November 16th at 6:30 p.m. for the sensory friendly. And then if there's someone who needs American Sign Language, that showing is on Saturday, November 18th at 7:30 p.m. And then we have our Windy City Bulls. If you wanted to take your child to a basketball game and making sure it was sensory friendly, we have a complete sensory floor where we'll be at hanging out. We're going to be giving out raffles, and we're going to have all kinds of resources. And we invite you to join us on November 19th on Sunday at 5 p.m. If you want to come out, it's going to be superhero night, so you can have your child and your family dress up in their favorite hero costume. So I wanted to tell you about those two events. And then now is probably the part that people are really excited about, because there's a lot to learn about what medical insurance do I get for my child who I'm trying to seek access to ABA therapy, but maybe I'm on Medicaid. So I want to make sure that I state this, because this is so important. So many people think that because they're on Medicaid, right, that they can just go to the marketplace, what people like to call the Affordable Health Care Act, and they can just go to the marketplace website and then just purchase insurance. But that's false. What people don't realize is that the marketplace is considered a government funded insurance, just like Medicaid is considered a government funded insurance. And you cannot have two government funded insurances. One will cancel the other one out, and unfortunately, it will cancel your Medicaid out. So there is a way that even if you're on Medicaid, that you can still access private insurance specifically to access ABA therapy and still have access to the HIP, the government grant through DHS, to cover your medical insurance premiums. And we're going to jump right into that. So without further ado, I'm going to bring on my girlfriend, Stephanie Thompson from LT Family Financial. Are you ready, Stephanie?
I'm ready.
All right, let's do this. Share your screen, sweetheart.
All right. Thanks everyone for joining us tonight. I'm excited to share with you some basic terminology and also overview of health insurance. Give me 1 second here. I'm going to share my screen. Here we go. Okay. And perfect. All right. So a little bit about myself. I am a licensed broker. I can work with families looking for any sort of health insurance. So my job, I am also a mom of a little boy who is on the spectrum as well. So this touches near and dear to my heart. And I just wanted to give a big shout out to Tamika for everything that she's done. And Layla for everything you educated me on ABA. So I really appreciate it, ladies. Thanks again, everyone, for joining us. Let's kind of jump in here. This is one of my favorite posts because I'm just a huge fan of Ryan here. But, whenever we look at health insurance, it's so confusing. You get this booklet of 140 or 50-page document, and you have no idea what it means. So I always thought that was an appropriate way of just kind of starting off the night. We're going to jump in to a little Q&A, or true false, if you will. That monthly premium that you get every month, that you have to pay that bill, do you think that's the only cost that you would have to consider paying for your health insurance?
Definitely
The answer is
not.
that's right. Good job, Tamika. Yeah, the answer is going to be false. There's lots that go into how much your out of pocket overall, what you're going to pay every single month comes out to. So we're going to do what I like to call a deep dive into all the different nuances and terminology that's built inside those plans. What we have here is an example. This is a live example I pulled off of the website. This is an Illinois Blue Cross Blue Shield Bronze PPO plan. Now, we'll go into specifics later, but I want to just give kind of like a highlight of really those shocking prices and those shocking numbers that they don't like to put whenever you're shopping these plans. As you can see right off the bat, the premium, in my opinion, is, $250 a month. Not cheap, but not the most expensive plan either. If you look over here, it says your estimated annual cost is $12,443. Where in the world did that come from? See all these other figures here. We have deductible, out of pocket. Now we look down here at co-insurance. These are some of the terminologies that even I sometimes get a little confused on. So, they don't make it easy, unfortunately, for anyone to understand. So hopefully you'll find during this presentation that we can learn a little bit more basics about these to make it make sense for everybody.
And the really thing that I think is really important to point out, especially Stephanie, is that a lot of people will contact the Autism Hero Project and they're like, well, I purchased a plan, even though our Q&A specifically said, try to get gold. We're paying the monthly premium, so get the best that you can get because we're the one paying for it.
Mhm.
And I understand that they have to pull out the initial payment, right? Before they get reimbursed on that initial payment. And so they go for the cheapest plan because they're like, it's only costing me $250 a month, but it's actually costing you more than had you gotten the gold plan. And so we're going to show you that just because monthly it seems like it's less money, it's actually going to cost you a lot more. And this is why it's so lucrative for yourself to contact a private insurance broker to help you navigate and understand what you're purchasing.
Yep. Thank you for that. And just to touch on what Tamika had said originally, premium is what Autism Hero Project is talking about when they say premium. So that's that monthly cost. Autism Hero Project, unfortunately, they're not able to pay for your co-pays and your doctor's visits and your ER and your urgent care. They are doing a tremendous job of helping pay for this premium every month. So when she said we're not included in that premium, that buyers beware, they should be aware of. So this slide, we're just going to, again, high level, this is going to calculate everything that's involved when we go into the annual cost of what your insurance will pay, won't pay. And you're going to see a lot of jargon on here, and we're not going to go box by box, but just to kind of give you an idea, we're about to deep dive into each of these categories. So that way you can feel more comfortable when it comes to talking to a broker about the different plans, or even when you're shopping online yourself. Excuse me. So the first one we're going to jump into is one of my favorites. It is the deductibles. So I love this. It says, if I win the lottery, the first thing I'm going to do is meet my deductible. Well, gosh,
Love it.
don't we all feel that way? Sometimes we look at these high deductible plans, even from our employer, and then we go, gosh, what does $5,000 deductible mean? Do I have to pay that? There's so many questions that go in our heads whenever we look at these deductibles, and honestly, it gets scary. So let's see exactly what a deductible truly is. So when you look at your plan, your deductible is something that, you see my little stick figure here, is money that we are applying towards that figure. So if our deductible on our plan, let's say, is $750, we'll just go off of that as an example. The money that we're paying, including our copays, are going towards that deductible. Once that deductible is met, so that's $750, once that is met, now our additional parts of the insurance are starting to be paid out to help cost share. That's a special word that we got to keep in mind. That's something that they are going to share the cost, they being the insurance carrier, with us. So it's important that we meet that deductible. Now, some of us may be asking, well, what counts towards deductible? What doesn't count? Do I have to meet a deductible for everything? Good news, guys. Deductibles on some plans, actually most plans, are going to be waived for certain things. Let's take a look. Preventative services. Do we know what that is? Preventative services are going to be something that is your annual exam, your physicals, things that are keeping us well, wellness care. So those are typically no deductible is necessary. So let's pretend I have a plan and it's $750 deductible, and I'm going to take my son Danny to get his annual exam. Do I have to meet that $750 deductible? The answer is no, because that is part of wellness care. That is something that does not have to meet a deductible. So right off the bat, my plan is active for that particular treatment. If I go and let's say I break my bone and I have to go to the hospital or I need surgery, now we're going to start looking at those deductibles, and now we're going to have to start seeing where those fall in our plans. And I bet you 99% of those plans are going to say, you got to meet that deductible. So that $750, guys, is going to come halved out of my pocket before the insurance company starts to cost share, help pay for all those surgeries and outpatient and all of the additional services provided. We're gonna do another little pop quiz. Oh, shoot, I gave you the answer. But when you have a health insurance premium that is $400 a month, we'll say, and that deductible is $750. When I start paying my plan, do I just pay the $400 a month? Do I pay the $750 a month? What do I pay before my health insurance starts paying their share? Well, I already said it earlier, and we'll say it again. Depending on the service that is being requested, you would have to pay, obviously, your $400 a month premium, that never goes away, and your $750 deductible. So that scenario I gave you, break a bone, got to get surgery, option A is going to be something that we're going to have to look into. Okay. Jumping into our next topic, deductible and copay. So what is a copay and what is a deductible, and how are they differentiated? So a copay is something that you, the insured, are going to, again, as I said earlier, cost share. You're going to hear that a lot. And that's just really a simple way, in my opinion, to say, hey, we as the insured are going to share the cost with you, the insurance company. So when you look at this here, it just shows that that copay is something that's going to be designated to you whenever you buy your plan. And it's going to give you, the buyer or the insured, an idea of what's going to be coming out of your pocket every month. So if we look at the true definition of what a copay is, it's a set dollar amount. So again, there's no surprises here. We want to know what we're going to be paying every month. Moms, all of us, we don't want those special surprises. We got enough. We don't need any extra bills. These are the things that are going to set the stage so we know what to expect. So in this example here, Sarah had a copay of $20 for her primary care doctor. So she goes to the doctor. She pays $20 every time she goes and sees that doctor. If she goes in for urgent care, I know this year that sinus infection that's going around Illinois, it's been terrible. I've gone to the urgent care a few times for my own family, even myself. That's $40 copay. I know I'm going to pay it when I walk in that door. Essentially, that's what a copayment is. It's a designated amount that you know that you're going to pay for those types of services. One thing to take note, your copays are not all the same. So if you notice here in that simple little example we have, when she went to see her primary doctor, it was cheaper than when she went for urgent care. So whenever you look at your copays and when you're looking at the different plans, it's important to note specialist, copays, telehealth, urgent care, and ER. Also, if you are someone who is, let's say your kiddo needs additional medication, let's say those specialty drugs, for example, that's something else we have to talk about. So not only do we have to look at deductible, copay, premiums, but we also have to pay attention to what drugs are covered, because that's a whole nother part of the equation.
And let me jump in and give a perfect example of that.
Sure, go ahead.
There are many, as we know, autism most of the time does not come alone, and there's other co-occurrings, or what we call comorbidities that are now called co-occurrings, that come along with autism. For example, there's a high prevalence of autism and ADHD, right? A high prevalence of autism and epilepsy, right? When it comes down to things like that, your child will need medications. And so sometimes you want the generic, right? Or sometimes you don't. You want the actual label, right? And so depending on how your child reacts, It is so extremely important to be transparent with your private insurance broker. They don't know what they don't know, and you can always tell if they're a good insurance broker or if they're not a good private insurance broker, because if they do not ask you, you might actually get the wrong plan. What do I mean by that? I can give you an example. Someone who got insurance not through our private broker recommendations of lists of providers that we provide, but they went and got it completely on their own. Their child actually had Medicaid, and they also took, quite a few different medications. Well, they were not able to get their insurance really to cover it at first because they picked a bronze plan, and they had to meet their deductible, which was extremely high, and it really caused a whole issue of problems. They had to change the insurance, they had to delay it. So it will behoove you to make sure that you are sharing all that you can about your child's needs when you are looking to purchase your medical insurance, as well as really, really important. And I'm sure Stephanie may or may not get to this, but I'm sure she will now. Um, if you plan on doing ABA therapy, which is the whole reason why you're coming to us, right, to get a medical insurance grant application, it is extremely important to consider already which ABA provider you're going to utilize.
Mhm.
A, B, if they have a wait list or not, how soon can they get started? But where does this come in with insurance? If it's going to be in center based ABA therapy or at home or a combination thereof, almost like a hybrid, right? We know that ABA therapy can happen in center or in clinic, depending on, what they consider themselves, in school, at home, in community. These are all places where ABA therapy can occur, especially if you're going with a provider who provides a naturalistic environment, right? But when Stephanie goes in and breaks this down a little further, the main question that she's going to ask you, or any good private broker will ask you, is if you plan on doing in center, at home, or a combination thereof. And then I'll let you continue on that, Stephanie.
All right, thanks for that. Yes, great points to draw in. We've got to look at the every plan, like I said, is different. This is where it gets really complicated. This is how everyone kind of gets in the weeds of all the specifics. And these are those surprises that, we'll get our explanation of benefits. That's your bill. You get it and you go, oh my gosh, why am I being charged so much money? I thought this was going to cover it. Those are those surprises that we are trying to uncover ahead of time so we know which plan is going to fit our needs the best. So let's look at another little true or false. Your copays. So we go back. Our copays are those, you walk in the door, what we're going to pay every time we see a doctor or a specialist. So true or false, do they count towards your deductible? The answer is going to be false, not always. However, they don't go towards your deductible. They go towards your out-of-pocket maximum. Okay, wait a minute. What am I talking about? Because I just talked about all this other jargon. Now I'm going to throw in another thing. What is this out of pocket maximum? Well, out of pocket maximum is something that excuse me, I don't know why this is like this. Forgive me, guys. Okay. Out of pocket maximum. And this is something that is designed to avoid any sort of those major financial surprises associated with your high healthcare cost. So this changes every year. This is set by the folks that help us out with, the individual health insurance plans. They have maximum out-of-pocket limits that they can charge an individual. So in 2024, so this has gone up a little bit from last year. 2024, now the maximum out-of-pocket limit for a plan cannot be more than $9,450 for an individual and $18,900 for family. What does that mean? Well, let's jump back a little bit. I'm so sorry to go. I had this slide out of place. Forgive me. There's something that's called coinsurance. So you may see this when you're looking at your bill or when you're shopping online and kind of seeing these different terminologies. What is coinsurance? So coinsurance is just a fancy way of the insurance carriers sharing how we are doing that word. I keep saying that buzzword, cost sharing. So coinsurance is where the insurance carrier is going to say, okay, you've met your deductible, you're paying your copays. Now we, as the insurance carrier, are going to say, you know what? We are now going to pay X amount of percentage towards your overall cost for that service. This is an example. This is not what every plan has. So if your co-insurance said 20%, well, good news. That means you're going to pay 20% of that service, and the insurance carrier will pick up the remaining 80%. Well, how is co-insurance different than copay? Because now I'm really confusing you guys, I'm sure. So co-insurance, again, is that percentage of cost that you pay after you met your deductible. So remember in the beginning when I said if you got to go to the doctor and just a regular urgent care visit or, just a wellness check, we have those copays that we pay, right? We also talk about that those don't go towards your deductible. Well, now when we've met our deductible, we have a whole different number that we have to start focusing on, which sometimes is better for us because sometimes it saves us on our copays. Every plan's different. I'm sorry if we're getting too much in the weeds, just giving you a highlight of what these terms are. So remember, coinsurance is going to be the percentage of the cost that you're going to pay after you've met that deductible. Your copay, again, is your set rate that you pay, that expected amount that you're going to pay when you go to see your doctors. When we look at the total ball of wax, okay, we're looking at deductibles, we're looking at coinsurance, copays, out of network, in network, all these different terms. What exactly does out of pocket maximum mean, and how does that apply? What is going towards that and what is not going towards that? Because if you remember from the beginning, our slide that we were looking at here at that example, where it said our out of pocket maximum, $9,450. You see that there on the slide? What exactly goes towards that? Because if I'm going to pay, this plan says $12,443. Well, isn't that more than the maximum $9,450? How, this doesn't make sense to me. How does this happen? Well, this is what it would look like. What would go towards your deductible? I'm sorry, excuse me, guys. What goes towards your out-of-pocket max is this nice lady here on the right with a big smile on her face. Your deductibles, your co-payments, and your co-insurance. All of those are going to go towards your maximum out-of-pocket. Well, what doesn't go? Those are going to be the ones that you pay the most, the ones that are most frequent. Those are your monthly premiums. Those are your out-of-network services. If you don't stay within that network of doctors, anything that you spend for services that your plan doesn't cover. So if you have any kind of specialty or specialized surgery, sometimes those are not covered. So again, it can get very expensive very quickly if you don't really understand the plan and what you're getting into. This is just another way of seeing the same thing. It shows you what applies and what does not. So you'll see here, just like the other screen, you got your in-network services. In-network is going to be typically the ones that you're going to pay attention to, that those doctors are going to be normally within the same agency. So I'll use Illinois specific. I know we have like Dooley Healthcare or Edward Elmhurst. Those are networks. So if you have something called a PPO plan, PPO plans are typically going to allow you to go to more doctors and more companies within a network as opposed to what's called an HMO. HMO typically is going to have a set amount of doctors and services that you want to stay inside, because if you go out of it, big money. They're going to be asking you to pay big premiums. So that's important to remember whenever we look at, especially for ABA, when you want to see, okay, how is my kiddo doing? So let's say you go to an ABA provider and it's just not the best experience. Or what if that What if that therapist went to a different company, or what if they stopped working at that agency? What are you to do? Your kiddo was having a great experience overall. Well, in a PPO, we have more options. We can go to another provider, and maybe they don't have a wait list, maybe they do. It gives us more options to really look at what's available to us. If we were in an HMO type of a plan, if this same scenario, we'd have to try to find a doctor, or excuse me, a provider inside of that agency. So it limits us, is what the HMOs do. Not that they're bad, they just limit some of those additional doctors and agencies that we can access. I'm going to skip this one. This is a little busy. Okay, so how would somebody be covered under two types of health insurance plans? So I love this slide here because it shows a young individual that is about to turn 26 years old, and they won't be covered under their parents' health insurance anymore. This is going to be the last doctor appointment, so test everything. So what I'm getting at is, you probably heard the magic number, age 26. So typically, if you have, if you're under the age of 26 and you are on your parents' health insurance, we do see a lot of folks that are on their parents' health insurance until they're age 26, and then they have to go on their own. So if that applies to you, you would fall into this category where now you would need your plan, and you also worked a job working full time and you had health insurance there. You could be what's called covered under both plans. If you are over age 26, let's say mom or dad has a plan through their employer and you have a disability, and now you're 26 years old, aren't you going to lose your coverage? Not necessarily. If mom or dad has a certain form they can get completed and certified by a physician, they can turn that into their employer and extend that health insurance for you, regardless of your age. Other ways that you can have two types of insurance at the same time is where, if you are currently receiving Medicaid, CHIP, TRICARE, those are for the military veterans. And also, if your parents have the coverage through work, that again, you can add another plan, like Tamika had said earlier. But here's the most important thing to remember, and this is where time and time it gets confusing for a lot of folks when they call. Whenever you buy your own individual policy, what we call child-only policy, that now becomes the primary insurance. Medicaid, CHIP, TRICARE, those become secondary. So if we remember that Medicaid is going to become secondary and your new insurance becomes primary, now again, we have to figure out, which plan did you pick? How much is it going to cost you? Because I know a lot of us are probably accustomed to the lower co-payments that are requested at some of these plans. So if we have, CHIP, for example, those doctor's visits may be $0. They may be $3. They may be $10. But whenever we're looking at a private insurance, those are going to be a lot more. So that's something that you have to be prepared for. When we have two policies, how do those work together? Your primary, again, that child-only policy, is going to pay first. It'll pay up to those coverage limits. Now, whatever is left, that remainder of that bill, is going to go towards your secondary insurance. Please, please, please don't assume all costs are going to be covered, because even after the secondary has their part to pay its share, you still may be responsible for other services that weren't covered. I have a family who had adult diapers that they needed, that they were getting covered by Medicaid. Whenever we started looking at the private insurance, private insurance was not covering those. So we had to fall back to the Medicaid, but then Medicaid didn't cover all of it. So again, there's going to be those surprises, and I don't want you to go into this thinking, okay, I'm going to have both of these. We're not going to have any bills. That's not what we're doing. We're just trying to help you get more services and better quality care where without having to go on these long wait lists and be limited to your accesses. Now, as Tamika had said earlier, we have Illinois specific plans, but I'm sure you're familiar that Autism Hero Project also has some folks that are in Florida as well. So I'm just going to highlight a little bit between the two states, if that's okay. And then we'll start wrapping up here soon. So this next portion is going to be Illinois specific only. So any of you Floridians, this would be, time to drink, because this would not apply to you. But this is going to apply to the differences, because I know that a lot of times these seem to go hand in hand, and there are some differences that you should be aware of. So the CHIP is going to provide low cost medical coverage only to those children that fall outside of the Medicaid eligibility. So if you think about when you're looking at qualifying for health insurance, and sometimes the family just makes too much, and now you're not qualified for Medicaid as far as eligibility goes, but you can't afford that big insurance family plan either. What options do you have? Well, that's where they come out with CHIP. It gives you limited coverage options than Medicaid, and they do have, it's more state specific, if you will. When you look at Medicaid, Medicaid is going to be much larger because it's federal. So they provide free or low cost medical coverage. So same thing as CHIP. Big difference though, CHIP is for kiddos, Medicaid is going to be for adults. Also the poverty line, this is where they're going to look at what is below the poverty line here. So when you look at the comparisons, CHIP is going to be obviously more focused for the children. Also, it's going to be state specific here, where Medicaid definitely going to be a larger scale of opportunities that folks can be, qualify for, and it does cover for adults as well. Get down here. So again, folks who are in Illinois, you may have heard of All Kids, excuse me. What this is, just a quick little overview if you're new to this. All Kids is going to be the healthcare coverage is to the children. So it's going to fall under the CHIP. They also help in paying your premiums. When you go to the doctor, your costs are going to be minimal. And your premiums copays are going to be determined on how big the family is and the total income. So if you want to take a look, and why this is important again, is because whenever we add a private policy, if you're accustomed to this sample here, where your monthly premiums are $0, your doctor's visits are less than $4, your prescriptions are $2, your ER visits are $4, I get you the information for a private plan. Well, now what if your medical visits are $10 or $20? Those are the things that you have to budget for and be familiar with. These are the things that I don't want you to get a surprise with, because this is very important whenever you're accustomed to a certain plan. A few of the carriers that are in the Illinois marketplace, again, if you're new here, these are going to be the ones that are with All Kids and Medicaid, so within Illinois. And when we look at, why would we look at adding separate policies? I think I've already covered it a few times, but again, as Tamika had said earlier, the private insurance is going to give us a much broader range of providers. We're not going to have those long waiting lists that just seem unachievable, if you will. And, we're going to have more of an opportunity to make choices that we feel are best for our family, rather than being forced to only a certain network and being told that we're going to be on a long waiting list and we may or may not ever get the care that we need for our family. Look at insurance plans. They have what we call metals. So metals have nothing to do with if it's a good plan or a bad plan, or if this one's that much better than the other. It really depends on how much of the insurance company is going to be participating in our plan. So if you remember earlier on for our first example, and Tamika had chimed in on it as well, is that we look at the bronze plan. Typically, when I first started looking at these plans with clients, the bronze was the popular plan to look at. But when we add in ADA, bronze may not be the best route to go to, simply because of how much it is going to charge you out of pocket expenses. If you look at this chart here, as you can see, that special buzzword I was using earlier, cost sharing, the more money the member pays, the less out of pocket they're going to be responsible for, because they are cost sharing more into the plan. That's going to be your platinum. See that there, it covers about 90% is what the insurance carrier would provide. That's not for every plan, that's just generic, about 90% versus bronze at 60%. But again, there's caveats to this, because you have to be familiar to a broker like myself and I ask you specific questions. It's really to find that specific metal type plan to start looking at, because the last thing I'd ever want to do is put you into a plan that's going to be, something that you're not going to use, or something that you're using and you're paying too much for. So that's really why we have to have that in-depth conversation. This is an example, or excuse me, this is actually a live, just high level comparison, if you will, of the Illinois PPO type plans that are offered. And I don't know if you can see the screen, if it's a little small, but this is just to give you an idea of what's out there. Again, Illinois. So the first two columns, Blue Cross Blue Shield Illinois originally had PPO 204. That was the most popular plan that we saw. BCBS, or Blue Cross Blue Shield, has made a couple of changes. They've added a new plan called the PPO 707. So if you look at the example here, you've got an individual deductibles. They're significantly different, in my opinion. The 204 plan is $750 deductible, where your 707 is $1,500. So that's significant, in my opinion. Your out-of-pocket maximum, $94.50 on one, $8,700 on the other. Primary copay. So when I'm going to go see my regular doctor, your 204 plan is cheaper. It's $15, where your 707 plan is a little bit more. It's $30. But here's the kicker. So when we talk about ABA, this is what I want you to focus on. Your specialist copay. The Blue Cross Blue Shield Illinois Gold PPO 204 plan, now it's 30% co-insurance. What is co-insurance again? You are responsible for 30% of that bill. So is that a hard number that you're going to know every time you're going to go for ABA, what that's going to cost you? No, it is a co-insurance. It is a percentage. Whereas the PPO 707 plan, albeit it has a higher deductible, has a higher primary copay, but it has a set amount for specialists and ABA at $60. And when I say that, that is in clinic. That's not in home. I did not put in home on here. I just put in clinic pricing. So I wanted to make sure I make that statement that this is for the in clinic cost. And then if you look below there, there are your urgent care prices. So I hope this makes sense as far as the details, if you will, that you've got to pay attention to when you're looking at the plan differences.
Plus, one of the great things is at the end, they'll have information on how to contact you, Stephanie. This way you can handle each one, just like ABA is customized, very specific to the child's needs, insurance works the same way. So I'm sure that any offline questions that you get, you can help address what those needs are if they're going to do in center, in home, or in community, or in school. And then we're going to launch right into the last part, which is Florida residents only. Are you ready?
Ready, thank you. So Florida residents only. So those of you who are in Florida, I'll tell you, you guys have got a wonderful and very rich plan that is offered for your family members out there. So it is fantastic. Florida
Let me
has a
throw
plan
this in
called,
real quick before you talk about this too. Very different dealing in Florida than Illinois, where Illinois barely gives families access at all to ABA therapy. Florida does a great job because they have a lot of Medicaid providers who either A, only will provide ABA if a child has Medicaid because they're only a Medicaid provider, or they have a lot of ABA providers that take both here. So it's very different than Illinois, where you can't even find someone to take Medicaid practically. And if you do, they have a huge wait list. So Florida currently does have some wait lists, but there are some that have zero wait lists who do take Medicaid. So this grant for the Autism Hero Project, before we jump into the individualized plans, I just want you to know that if you can access ABA without a long wait, then you really don't need this grant, and save these grant opportunities for those who are having a hard time getting access. Okay, Stephanie, take it away.
all right, awesome. Yeah, thank you so much. Yes, I have learned that Florida does not only have beautiful beaches, but it also has amazing programs that are here for our communities. Here's some just basic information that I was able to gather. And a huge difference, and I don't know if Tamika's familiar with this or not, but it's called an EPO. So in EPO, you hear HMO, PPO, but EPO is a little bit different. You don't hear that as much, especially here in Illinois. So an EPO is an exclusive provider organization, or a hybrid, if you will, between an HMO and a PPO. So if I got some Illinois folks here, if you want to take a quick break and get a drink or bathroom break, we're still focusing on Florida right now. So what I collected were a couple of plans out there, folks. We've got the Am Better from Sunshine Health. That is not Blue Cross Blue Shield. That is another provider out there. They have the EPO, which is that hybrid, if you will. Look at that deductible, guys. $0 across the way. Out-of-pocket maximums, $5,500 with Am Better. Your copays, $5. Us Illinoisans are getting jealous over here. Your specialist visits are 60 and urgent care is 35. So that's going to be for Am Better. If we look at the Blue Select is going to be Blue Cross Blue Shield version in Florida. They also have got these wonderful plans here. So you've got your gold and your platinum. And as you can see, the differences there are, pretty similar, yet I would say the platinum is going to save you out of pocket maximum all the way down to $3,200 versus the gold at $6,250. Here's the one that I really want to, if I got some Floridians on here, pay attention to if you don't mind. This Blue Cross Blue Shield has now released a newer plan. This is a plan that I'm familiar with when we look at health insurance for employers. This is a very popular employer plan. I haven't seen this a lot in the individual markets, but what it's called the options plan. So I have had great success with these. However, it can get even more confusing. So buckle your seatbelts. No, but the blue options, kind of the best way I can describe it, folks, is it's kind of like an HMO inside of a PPO, if that makes any sense. So they have different categories as to how much they will charge the insured. So let's take a look at those little asterisks I put here. So they have $20 value providers, $0 value providers. So what the heck is a value provider? So they're going to have different providers that fall under different categories within those options. It's a beautiful plan, just you got to leverage the tools that are given to you on these, which are those provider network researches. So every insurance company, anywhere you look, they're going to have those look up a provider or participating provider. In the options plan, it's a must. You have to make sure that you're looking at those participating providers, because I don't want you guys to get stuck in, thinking you're going to pay X and come out paying Y and Z. Does that make? I hope that makes sense. Again, it can get complicated, but it's a great plan to have. But again, and then I'm finishing up on the presentation here for everybody. So Illinoisans, welcome back. You know, one of the things I hear a lot is, how much do you charge? Well, again, I'm a mom just like you. I have a kiddo on the spectrum. I'm doing the best I can to, try to help our communities really get the best services for our kiddos. So I love this little meme. It says, spending my day looking for insurance is a great use of my time, said no one ever. I tell you what, if you ever go and you start shopping around insurance, your head will spin and hours will just go by without you even knowing. So that's where a broker like myself, or anyone that you're working with already who is familiar with these plans, definitely leverage them. They shouldn't charge you anything extra to do this for you. They should be there to help you, guide you into what plan is best for your family's needs. They've got to ask those questions, like Tamika had said. They've got to understand what you are needing to cover your benefits. It's not all about how much is the highest price you're going to pay out of pocket. It's really what plan is going to fit your family's needs. So a little bit about LT Family Financial. That is where I work with my business partner, Tony. He's on this picture as well. We are located in Illinois, but for Floridians, we are licensed there as well. We are licensed in Texas and some other states also. If you do want to reach out to me, please leverage this QR code. Trying to keep a calendar to give everyone adequate time to spend individually, and this will take you directly to my link to help you get set up with everything. You do see a special needs mom squad. Again, I am a mom with a kiddo with special needs, so I created this special resource, if you will. Check it out. We've got a website that does offer additional resources. If you are in Illinois, make sure you check out. We've got some really fun upcoming events as well. Sorry, I don't have them posted on here, but we just did a sensory-friendly trunk or treat. We've got a holiday party, and of course, we're going to do a sensory-friendly launching of the new Trolls movie end of November. So again, Tamika, thank you so much. I love this day. I look forward to it, and I just feel so honored to be a part of your team.
Awesome. Thank you so much, Stephanie. I really appreciate you coming on. You are a wealth of knowledge. We've come a long way in all these years that we've been working together. So I want to quickly just share a couple more things. Connect with Stephanie Thompson, LT Family Financial, for your insurance needs. If you're looking for, ABA services I would say, are you on the southwest side, Layla? Is that where you're at, right? In the southwest area of Illinois. And then, I just want to really quickly share we talked about the stats, right? And we got to make sure that we get these applications in. And so here's a QR code, or you can visit our website, autismheroproject.org /applications. It's probably really important that you get there and get there quickly, because our application deadline is a hard November 15th at 11:59 p.m. Basically in Central Standard Time Zone. So if you live in Illinois, Central Standard. If you live in Florida, Eastern Standard Time, 11:59. Those applications have to get in. I really want to emphasize, and I'll show you that really quickly in a second, what our application looks like. But I just want to emphasize one thing. We could not do what we do if it wasn't for, honestly, a village of heroes who are very intentional about being the village to our autism, community. And so we basically run on donations. And because we run on donations, we are not too proud to beg. Please head up our website. You can donate online. If you do company matching through your organization, payroll deductions, if you want to collaborate, we go into organizations and put on presentations. If you have a business, we are super creative. We want to partner with you. We have been creative with restaurants. We have been creative with theaters. We have been creative with, supermarkets, you name it, even oil change places that wanted to be the village. Like there's a way for us to work together. And so we want you to really reach out to us. And then I just want to quickly show you before we end this. Um, when you go to our website, I kind of showed you where to find the application, but I wanted to really make sure that I emphasize. And so I'm going to share my screen one last time on our website. When you go to our website, right, we have these tabs across the top, right? Home, donate, media center, our grant application. So you click on the grant application, and as you see, it's now open till November 15th, no exceptions, right? And when you get past the video and all that, I'm just going to show you when you click to download, this is probably really important to see. We have the Q&A there for you, right? But here's where you click. All of your answers, if you've been granted an app, a medical insurance grant, you will have your answer no later than December 11th. We know that the marketplace is open through January 15th, both, for those who can go to the marketplace and even for those who are on Medicaid who can't go to the marketplace, the private insurance brokers are capable of getting you access till January, through January 15th. Now, if you want a January 1st, 2024 start date, then you have till December 15th. If you don't mind starting February 1st, then you have, a deadline of January 15th. It's really, really important, though, that you know that your deadline application with us is November 15th. But know that if you get granted, you're going to want to call around. You're going to want to know which insurance plan you want up front, and you're going to want to know what ABA provider is going to service you. So start calling your ABA providers, finding out if they have a wait list, if they have a team ready. Let them know that your insurance is going to go into effect, let's say, for example, January 1st. But when you click on this, after you get past all of the Q&A and the example, if you're someone who has employer funded insurance and yet you just can't afford your employer funded insurance that does give you access to ABA, but you can't afford it, right? Know that we will pay the difference between your employee only amount and your employee plus dependent, or if it's a family plan, then your family plan. So I'm just going to give you an example. Let's say for an employee only, your employer insurance premiums are $75, right? But for a family, they're $160, right? We will pay that $85 difference between having insurance just for you, the employee, and then having to add on your dependents. So we pay the difference. If that is that you get insurance through an employer that does give you access to ABA, but you just couldn't afford it. Now let's rewind. Let's say that you have Medicaid and you have to go to the private insurance broker. We will fund your child's full 100% medical insurance premium for your child. And we will tell you it behooves you to get a gold plan, maybe a silver plan. Every state is a little differently between Florida and Illinois, but in most cases, you're going to want to get a gold plan. And we will pay the full 400 and 30, $40, whatever that is. We do have a cap, so, because sometimes it depends on zip code and child age, if they're 15 or over. So sometimes I'll give you an example. We have funded children over the age of 15 and their insurance premiums as they get older were more expensive. They were like 500 and something dollars. We did cap it, I think, at 450. And then the parent just paid the $50 difference because we do have a monthly cap. So know that as well. Also, if you have a self-funded employer premium, right, who you got insurance that's great for everything else but autism, you're going to have to go get, either the marketplace insurance or a private broker. Just know that we will still pay the whole insurance premium for the child. And then I just want to say one other thing that's really important. When I say that the marketplace and Medicaid are two government funded insurances, it's really, really important to know why you cannot go to the marketplace. We've had families who've made that mistake and it's cost them, no matter how many times we put it in writing, no matter what our video said, and then they lost their Medicaid. Let me explain why. Because when you do your taxes at tax time, if you got insurance through the marketplace, you're going to get a 1095 form, that is the A, which is specific to the Affordable Health Care Act. And when you receive that tax form, you're going to have to declare that on your taxes, whether you worked or not. You are required to declare that because they've given you premium tax credits based on what you said was your household income annually. So maybe the insurance would have cost you normally $500-600, but they gave you a tax credit every single month and you didn't have to pay, or you paid very minimal. It catches itself when you do your tax return. And so let's say that there was more income there, right, than what you had disclosed initially. You're going to have to pay back all those monthly tax credits that they prepaid for you in advance. And so people make this mistake all the time. Please use a private insurance broker who can guide you better, especially if you have Medicaid. If you don't, then that's different, because you might want to go to the marketplace and get that premium tax credit if you fall below an income level. All right. But really quickly, after you got past the Q&A, this is where the application starts. You click on the application and it'll take you to our Google form, and you just start filling it out. It's pretty simple. There's sections in it, right? Not too hard, right? But I will ask you to upload, evidence of an autism diagnosis, the comprehensive stuff, right? We will ask you to complete a PHI, which is the authorization to use and disclose protected health information. So you will have to sign that and upload it. You will have to upload your tax returns as evidence of your income limits, because it is based on, 6 times the poverty line. We have, so much funding, and there is a priority for lower to low middle income households, depending on the amount of applications we receive. So if you do not upload any of these documents, your application will not count. You would have wasted your time, because without all of the things that we're asking for, your application will be considered incomplete. So please ensure that you do that. And then, lastly, I just want to make sure that you guys know that when we ask you, what is your, your portion of the insurance, we're asking you to look at your enrollment guide for the upcoming 2024 year. I've highlighted here, right? Just so that you know what is your per paycheck out of pocket. That's going to determine the difference that we pay. So I think I've covered everything. We've been answering questions in the chat as we go along. Let me just check in and make sure there's no additional questions. Jamie, who I have on standby, my vice president, any additional questions that I can't see on the Facebook Live because I'm doing this, please let me know. I think we're good, guys. So again, if you have any further questions, please tune into the autismheroproject.org. It has been a pleasure to serve you. Thank you to our beautiful guests, Layla and Stephanie. I'm sure you'll be getting phone calls. We appreciate you. Thank you to our sponsored technology, Ollin Technology. We love you, Enrique. And that is all. Have a great night. And we're here to answer any of your questions. Email us at autismheroproject@gmail.com or enter your questions into our website and we will respond accordingly. Have a great night.